in the U.S. are experiencing unacceptable and avoidable heart-related illness and death. That's according to the Centers for Disease Control and Prevention. CDC also states nearly half of U.S. women don't realize that heart disease is the leading cause of death for women. Dr. Hasti Sanandajifar, I'm so sorry, but your name is joining us. She's a cardiologist at Texas Children's Hospital. She treats children as well as adults with congenital heart disease. So thank you for your time. And apologies again for your name. Yes. So why don't women know how deadly heart disease is? What's the problem here?
So I think that the medical community and kind of the history in the medical field has been more focused toward men in terms of heart disease. And so the typical symptoms of heart attacks and heart disease that we see have been more focused toward men. So, chest pain, radiating down your arm, severe falling down, nausea, vomiting. But sometimes women have atypical symptoms of heart disease. So women having heart attacks could have nausea or vomiting or feeling like they're having a panic attack. And sometimes the pain doesn't classically radiate down your arm. It could be to your jaw or somewhere else. So I think as a medical community, we need to educate women a little bit more about the atypical signs of heart disease. We also need to have a higher index of suspicion when a woman comes in with atypical symptoms to the ER, for example. And women also need to kind of be aware of these symptoms and advocate for themselves if they're feeling something's not right, to seek care. And also, of course, prevention is another part of it.
And that's a little scary because nausea, these are such broad symptoms that belong to so many different categories of illness. So at what point do we need to seek help if we're experiencing some of these symptoms? And can it be just one, or does it need to be a combination of these symptoms?
So I think it depends on every patient. And if you're worried about something going on, seek care. I think you never go wrong with going to your doctor and talking to your doctor about it, or going and checking yourself out. In terms of prevention, I think, women also need to be similar to men, exercising regularly, eating a healthy diet, plenty of fruits, vegetables, whole grains, lean meats, managing stress levels. Women, we know, have to deal with a lot of things throughout their lives, whether it's pregnancy and hormonal changes and raising children, in addition to women now working full-time in the workforce. So I think managing stress, making sure you try to find ways of getting enough sleep. I myself, do yoga, meditation, these things in addition to just kind of the regular healthy lifestyle that we usually recommend. And that goes a long way in terms of, increasing your heart health and making sure you as a family have a healthy lifestyle.
Talk about screening and how important that is for not just women, but men and children.
Yeah, so screening's actually really important. I focus actually even more on pediatrics in my practice, and we have multiple screenings throughout childhood and then also for adult life on, cholesterol screenings, preventative care screenings, sports screenings for young adults to try to pick up cases or history that could be significant for sudden cardiac death, for example, kids passing out on the field.
Right.
We have primary prevention, which is, those screenings to try to kind of throughout life help prevent disease. And then we have secondary things like, making sure people know CPR and having defibrillators on the field for kids so that when they're playing sports, they're protected if there is something going on. In children, so even from fetal life, women who are pregnant get their regular screenings and their prenatal care. If there's ever any concern, we do, they refer to us as cardiologists, and I myself and several other, it's a field within cardiology that we do fetal echocardiograms to check the baby's heart health and the structure and the function of the heart so that we're prepared for anything that might be going on. And then when babies are born, there's multiple screening processes to look for congenital heart disease and other things that could be going on. And throughout life, just making sure you're going to your doctor, you're having your regular screenings, your blood work, and we have pretty standardized processes for all of